child, as I mentioned before, and at the same time we perform video recordings. And then the task we have is like to here on the EEG, which is the onset of this activity, where this activity comes from, just before the onset of the seizure. And then if you see here how the activity changed dramatically, and the child has like a tonic-clonic seizure while we perform simultaneously EEG and video recordings. And with my team, we have developed this innovative technique by using electric source imaging. It's a quite unique technique, so we're able to identify in the EEG signal and localize non-invasively where the seizures they come from. And we know now that this information, this also has predictive value. We can predict the surgical outcome of the patient. We know that if we resect this area, the child will become seizure-free. The problem with the non-invasive test is that, like in several cases, the results of this test are either inconclusive or they are non-concordant. So this means that, like, for example, the EEG can show you one area of the brain, the MEG can show you another area of the brain, and the structural abnormality with the MRI to be in a totally other area. So in these cases, like the epileptologists, they don't know exactly what to do. And in these cases, the children, they go to what's called phase 2. In the phase 2, we place invasively electrodes inside of the brain, either through what's called electrocorticography. So we open surgically the scalp of the child, and then we place some grids or strips that record the activity directly from the cortex, or we place what's called stereotaxic EEG. We'll place depth electrodes if we are suspicious that the activity comes from deep areas in the brain. And nowadays, like we have a more advanced and less invasive technique, where, for example, what's called stereotaxic EEG, and Cookson develops that for and used this technique for several years. There's no need for these big craniotomies or this invasive procedure. So with minimal invasive procedure, you open through by using a robotic, a small hole in the scalp of the patient, and you implant electrodes, and you are able to record the activity by using this kind of advanced method. These invasive methods, they help us to identify very precise biomarkers of epilepsy. This is a work my team is specialized. It's called high-frequency oscillations. It's very fast activity in frequencies more than 80 hertz. This kind of activity oscillates very fast in the brain, more than 80 times in a second. And several studies have shown that this is a very promising biomarker of the epileptogenic tissue in the brain of the children. And this kind of activity can be subcategorized in what's called ripples and fast ripples. The ripples, they have frequencies between 80 and 250 hertz. And the fast ripples, they have a frequency between 250 and 500 hertz. The ripple zone, or the area that generates the ripples, can be relatively large, and that's less specific, but can be seen in several patients. On the other hand, the fast ripples, they are hard to be detected in many patients, or they have low occurrence rate, but there is very, very specific zone of the epileptogenic, it's very, very specific biomarker of the epileptogenic zone. This is actually an accidental finding that that lead to a great publication and an important finding in the field of epilepsy. When I was analyzing some data from a child with epilepsy, I observed that this kind of high-frequency oscillations, they don't occur in all the electrodes at the same time, but they actually propagate across time from an area of onset to some areas of spread. And then I hypothesize that if we resect this area of onset, then this is sufficient in order for the child to become seizure-free. So there's no need to resect all this area that may overlap with the Eloquent cortex. It's just enough if we resect this small area and the child will become seizure-free. And that was indeed the case. We saw that for a significant large group of patients, pediatric patients, we saw that this kind of biomarker, the onset ripple zone biomarker, he was able to predict the surgical outcome with high positive predictive values and high negative predictive values. As I said, like so far and before, like it's not only important like to identify and localize the epileptogenic zone, where the seizures they come from, but also we should be careful to not to surgically resect areas where the normal functions of the brain they occur, and what's called the Eloquent cortex. And now we have advanced tools which give us the opportunity to map non-invasively this kind of areas in the brain. Among these areas, like the most easy to localize, what's called the somatosensory cortex, is the area that activates when somebody touches your hand or your body, or any kind of sensory input into your body. Then this area in the brain is activated. It's a very critical area for several functions of the human body. And how we make this kind of mapping, we stimulate with tiny electrical shocks the median nerve. The median nerve is a nerve that runs through our hands. And then we know that like the signal travels all the way through our hand, through this median nerve to the contralateral side. We know from physiology that if we stimulate the right hand, then the activity, the brain area that it lights up is on the other side. And what we're able to do, we stimulate the median nerve, and then we are able to record activity from the brain. But the problem with that is like that the signal is weak enough in order to be recorded. So we need to stimulate this median nerve several times, and then we average this kind of responses. And by doing that, like several hundreds of times, we are able to identify which area of the brain is active during this kind of stimuli. And by stimulate different parts of the body, for example, there's no need to provide only electrical stimuli. We provide here compressed air puffs. We with some plastic tubes, we stimulate the fingers of the child, and we are able like to map with high precision which areas of the brain are active during this kind of somatosensory processing. With more advanced tools like and more advanced like data analysis tools, we're also able like to map the entire network, because like there's no only one area of the brain which is active during this kind of complex processes, but there's many areas. And we're watching now a video where we see that like all these areas in the brain which are active during this compressed air puff stimulation of one finger. Another area that's very critical to identify is what's called the primary motor cortex. Is the area which is responsible for the different motor functions of the upper and lower extremities. This is like the most of the interest, and we're developing our techniques that use high density EEG, and the kids they play video games where they are moving their fingers. And by using this kind of technique, we're able like to activate, to map in the brain which areas are active during these finger movements. Another technique we use for mapping the primary motor cortex is what's called transcranial magnetic stimulation. We have these coils, large coils that they generate a strong magnetic field. This strong magnetic field non-invasively activates a focal area of the brain, and we can see how this setup looks like here. This is the coil, and my colleague places the coil next to the child's head, and we stimulate the motor cortex, and we see how the responses they can be recorded from the muscles on the periphery. So by using this kind of technique, we see here how a map looks like. We're able also like to before the epilepsy surgery to map also the area of the brain which is responsible for the different motor functions of the child. All this work is the results of like a great effort, and I would like to thank my team at Cook Children's. But most of all, I would like to thank all the parents and the families who come here and then help our research in order to improve our technologies and the tools we have in order to help sick children with epilepsy to become better. Thank you.